Okay, today we're giving some medications, intradermal injection to Casey Banks. So I walk into my medication room, I do hand hygiene, I open up my medication cart, and I look at my MAR, and we need Casey Banks 10-2-1965, has an allergy to aspirin. Casey is needing Tubersol, which does not contain aspirin, and sterile water, which does not contain aspirin. Casey Banks 10-2-1965, I need Tubersol. I go into my med cart, and I find Tubersol, which has been pre-drawn by pharmacy. And Tubersol, intradermal injection, today only, 0.1 ml, 0.1 ml, 0.1 ml of fluid. Do it 0900, and it has not been given on today's date. Take that, I'm going to set that aside. Next medication, Casey Banks, 10-2-1965, sterile water. Sterile water. For injection, 1.5 mils at 0900, and it has not been given on today's date. So now I'm going to be pulling out the remainder of the equipment I need. I need a 3 mil syringe with a blunt fill needle. I need 3 alcohol pledgets, and I'll be using a cotton swab for later on. So I'll be applying things to this cart. Okay. Alcohol pledgets are intact. There's no expiration date on them. My syringe is intact. There is no expiration date on it. It's a 3 mil blunt fill needle. My sterile water is intact. 2017 is the expiration date. It is clear. Nothing is floating inside of it. And I have 1.5 mils available. My Tubersol, expiration date is 12/2018, and it is the appropriate color for the medication. MAR-Check 1 is complete. MAR-Check 2. Casey Banks, 10-2-1965, has Tubersol. Tubersol, intradermal, Tubersol. Injection, today only, 0.1 mil, 0.1 mil, 0.1 mil. Be given at 0900 on today's date, and it has not been given. I'm going to place that inside of my tray to take into the room. Casey Banks, 10-2-1965. We have sterile water. Sterile water for injection, 1.5 mils. Do it 0900 on today's date. So we're going to draw that up. Our check 2 is about preparation. So I'm going to remove my cap. Set that off to the side, open up my alcohol pledget. We're going to cleanse the top. 15 seconds. Make sure that my thumb is covered by the alcohol pledget. Okay, pulling it off so I don't cross over. Move it forward. Now I'm going to open up my syringe. I'm going to tighten up my needle first, pull down on my plunger to loosen it up. I'm going to horizontally pull off my cap, place it against this hard surface so I can scoop it and connect it later. I'm going to pull down 1.5 mils. I'm going to bring my fluid down. I'm going to insert it in the center. Push down, make sure that my needle is in the air pocket, push air in, invert it, push my needle up. I'm going to pull down to 1.5 mils, get the air out. Now I'm going to snap my bubbles. Anything against the acrylic should be coming off and going up into the bottle. Any champagne bubbles on the plunger will stay there. You cannot get those off. I want to make sure the top of my plunger, there we go, is at the 1.5 mil mark, and I want to make sure that I have fluid into the hub of the needle there and not air. If I have air here and I invert it, the air will roll into here and displace my fluid volume, so I want to make sure that there's fluid there. Okay, I'm going to invert it, remove my needle, and there's no air bubble moving up. I'm going to insert, so I kind of place my hand down on the table, put my needle into the cap, and then I'm going to push against it to secure it. Okay, Checking to make sure we have the right volume. Sterile water for injection. Sterile water, 1.5 mils, 1.5 mils, and to be given at 0900 on today's date. So we're going to set this aside because we don't need that beyond this point for demo. Okay, I have my Tubersol in here. I have a little piece of gauze. We're going to throw in an alcohol pledget in there. My pen, my MAR, I have a pair of gloves. Now, when you're drawing up your medications, if your institution says to wear gloves, you wear gloves for your own protection, okay? So, we're going to now go into the patient's room. So, I go over to the door, I knock. Hi, Casey. I'm going to set my supplies on the bed. The table is clean. My name is Linda. I'm a Marian University student nurse. Hand hygiene before I touch my patient. I need to see your ID band, and could you please state for me your full name and date of birth?
Casey Banks, 10-2-65.
And what allergies do you have, Casey?
Just aspirin.
So I've checked my MAR against the band and the allergies against the band, and that all is confirmed. Okay, Casey, today your doctor has ordered for us to give you a tuberculin skin test to detect if you've been exposed to tuberculosis. The skin test will be on your forearm, and what I'll be doing initially is evaluating the forearm to find a good spot where the skin does not have any scales or tattoos, any scarring there at all, scars. If there's any veining there, so we're looking for pristine skin. So I'll be kind of palpating on those areas to find that. Later, I'm then going to be inserting a needle underneath your skin and give you a very small amount of fluid. This should not hurt at all. We ask, it's going to form a little wheal or look like a mosquito bite when I'm done. I ask that you not rub it or scratch it at all. We'll have to have you come back to the hospital if you've been discharged within 48 to 72 hours to make sure that we evaluate that site at that point to determine if you have had a reaction. And so if you don't come during the 48 to 72 hours, then we'll have to repeat the whole test process again. Okay, do you have any questions about this at all, Casey?
Nope, I think I'm good.
Okay, so I'm just going to check, make sure I've got the right medication for you, and then I'll start evaluating your skin, okay? So back to my MAR here. We have Casey Banks, 10-2-1965, has an allergy to aspirin, which we have confirmed against his ID band. We have Tubersol. I have Tubersol intradermal injection today only, 0.1 mil, 0.1 mil, 0.1 mil. To be given at 0900, and it has not been given on today's date. Okay, so I'm going to set that aside for right now. I'm going to, got a piece of gauze here if I need one at the end. I have a marking pen to go around the site after we've given it to Casey. And so I'm going to put some gloves on. And what the instructor will do is she's going to give you her arm, and she's going to have you determine where on that arm you're going to be giving the injection, okay? And so giving you the arm, we're looking again that there's no veining present here, that there's no moles at all, that there's no scar tissue, no tattoos present. I'm looking for basically pristine skin, and so probably in this area is where we would go. We also have to pull the skin taut, so you'll kind of come next to the skin and then pull it taut like that so that you can get the needle to go underneath just the very top layer of skin to create that wheal. Otherwise, you might go into the subcutaneous layer. Okay, another thing that you need to do is we always put a hand at the wrist and a hand at the antecubital. So this is the area that you'll be looking at for that skin surface. Okay, in class you created your bleb on the hot dog, so this will not happen with this equipment that we're using today. What we're looking at today is that you have it going in at the right angle, 5 to 15 degrees, that you haven't crossed over your site after you've cleansed it or over the needle once it's inserted, and that you injected the medication in safely. All right. So we're going to take you'll have a dry alcohol pledget that we'll be using. And we're going to start and cleanse in the center of the area for 7 or 8 seconds. So you're doing a 1 inch area, and then you're going to go out to the 2nd inch, and again doing 7 to 8 movements or seconds around, and come off so that you don't cross over. We're then going to take the needle. Now in your book it showed them holding the under part of your arm and stretching the skin taut and coming in. That's one way of doing it. Another way to do it, for demo here that we'd like to see because of the equipment we have, is that you will make sure that your little finger does not go on the plunger at all. You need to make sure that the bevel is up and you're checking for burrs, which we have none. You're going to come in with your fingers a little bit wide like this into the site where you determine you're going to insert that needle, and then pull the skin taut. You're going to come down, bevel up, insert at a 5 to 15 degree angle, 1/8 of an inch, grab your needle, and then push your fluid in. Wait a second or two, and then remove your needle and pull away. That's one way that we like to see you do it. Or you can come in a little bit farther apart, spread your skin taut. You're going to bevel up, plunger, finger off the plunger, come in your 1/8 inch, and then use your little finger, if your fingers are big enough, just to move that fluid in. Wait a second or two, and then pull out your needle and release. Okay? You are going to give the equipment to the instructor. She will recap your needle for you. Again, you're going to talk to Casey then and tell them, Casey, now on this, where we got this little wheel, this little mosquito bite, I'm going to mark that area with the marking pen, 4 dots, so we know the next nurse knows where to look for it. And then again, I remind you to come back in 48 to 72 hours. And I'll give you a little card to remind you of that. And then we're just going to come in. It'll take just a few moments. We'll just check it to make sure that if there's no reaction to it, and then you'll be all set. Okay? Do you have any questions at all, Casey?
Nope. I'll just come back to have somebody look at that 48 to 72 hours.
Right. And you can do your normal activities of daily living, take a shower, there's no problem at all, okay? Just try not to scratch it now or to press on it, okay? It'll be absorbed by the skin naturally.
Okay.
All right? Bed in lowest position, call light within reach, gloves off. Document then your time and your initials, and then where you gave the site, which would be the right forearm, the underside, and then signing off your name on the bottom, okay?